Hey guys, thanks for tuning in. My name is Russell Linville. I'm a sports physical therapist, and today is Nerd Out Wednesday, and that's when I talk about current literature or things I've read, statistics, all the things that we think about when we think about like a literature review. And so, interesting, I read an article earlier this week out of the Journal of American Medical Association Open Network, and it's looking at opioid use and how that plays a role in patients who participate in physical therapy. And so what I'm going to do is go over this abstract with you, and I'll provide the link. This is an open access article, and I think it's a great way to start our Nerd Out Wednesdays, start of the year, is to go over a little bit, maybe more of the dark side of healing, right? And that's what we've considered as this opioid epidemic. You hear about it all the time in the news. And how physical therapy can play a role in reducing your risk of opioid use. And so without further ado, let's get into it. So the title of this article is called The Association of Early PT with Long-Term Opioid Use Among Opioid-Naive Patients with Musculoskeletal Pain. It's an article that was conducted by Eric Soon, who's an MD, and his colleagues. So the abstract here, the importance, non-pharmacologic methods of reducing the risk of new chronic opioid use among patients with musculoskeletal pain are important given the burden of the opioid epidemic in the U.S. The objective of this study is to determine the association between early PT and subsequent opioid use in patients with new musculoskeletal pain diagnosis. The design, setting, and participants. This is a cross-sectional analysis of healthcare insurance claims between January of 2007 and December of 2015, included privately insured patients who presented with musculoskeletal pain to an outpatient physician office or an emergency department at various U.S. facilities between 2008 and 2014. The sample comprised of nearly 89,000 opioid-naive patients aged 18 to 64 with a new diagnosis of musculoskeletal shoulder, neck, knee, or low back pain. The data set obtained basically took ICD-9 or 10 codes, as well as CPT codes, and the date of service, as well as pharmaceutical information. And they looked at early PT as being defined as at least one session of physical therapy received within 90 days of the index date or when they were diagnosed with a condition. So the main outcomes and measures they looked for opioid use between 91 and 365 days after the index date, right? So once they've been diagnosed, if they've started PT within the first 90 days, they're looking at what the rate of them continuing to use it after physical therapy starts is. So of the 89,000 patients included, about 60% were male and about 40% were female. Among these patients, 26,000 received early physical therapy, and after adjusting for potential co-founders, early PT was associated with statistically significant reduction in the incidence of any opioid use between 91 and 365 days after the index date for patients with shoulder pain, neck pain, knee pain, and low back pain. For patients who did use opioids, early PT was associated with an approximately 10% statistically significant reduction in the amount of opioid use measured in oral morphine milligram equivalents for shoulder pain, knee pain, and low back pain, but not for neck pain. So in conclusion, the authors determined that early physical therapy appears to be associated with subsequent reductions in long-term opioid use and lower intensity opioid use for all of the musculoskeletal pain regions examined. Now, I have a bias because I'm a physical therapist that this study makes my heart very warm. Before I was a sports PT, I worked in a facility that we saw a lot of patients with chronic pain. There are a lot of other factors than just being injured that go into someone's pain, right? There's psychological factors, there's social factors, there's people who've basically their nervous system, if you think about these chronic pain syndrome type things, right, that there's a disconnect between what a threat is and what is really, maybe something that's noxious to tissue. And so pain is very, very complex, And I'm not going to sit here and try to explain this because I'm still learning a tremendous amount of pain, as we all are. It seems every week some new article or something comes out about pain science. But the good news here is that we know that moving more, even when you're in pain, seems to help reduce at least musculoskeletal pain, right? And this study backs that up, and it backs up in a great way that shows that you don't need to be dependent on opioid use to feel better. Movement therapy and even some of these much, much less addictive pain medications can get you through. I know in my own practice, as I'm talking to patients about this, yes, they still get, post-operatively, they'll still get, opioid pain medication. I think that's fair. But since I started in 2014 all the way to now 2019, I've seen a great reduction in the amount of opioids prescribed. And my patients have told me that they're actually being educated now post-operatively on how to quickly switch over from an opioid-based medication to something like Tylenol, like acetaminophen or an NSAID, rather than stick on the opioid. We're also seeing that physicians' offices now are having these, I don't know what you want to call them, they're not buyback programs, but basically you take your old prescription opioids in and you can dispose of them that way, so that they're not just hanging around your house, right? So that you strain your back in 3 months from now and you have some opioids from your knee surgery that was 2 years ago, and you take one at that time. It's not how it should work. So really good that we're seeing these take-back programs as well. Our job as a physical therapist is to really educate the patient once they get out of surgery. How can we make you feel better in a more natural way? Pain is normal, especially after an injury or surgery. Becoming dependent on something to help reduce your pain is likely going to, and this is just a very non-research based opinion of mine, but staying on an opioid or a pain medication for too long it's going to be, your pain is going to last longer because you're always looking for something external to help reduce your pain rather than working on what you can do to help your own body heal itself. And so physical therapy, we talk about the 5 steps to getting someone back to doing what they love or getting back to sport. And those 5 pillars, number 1 on my list is reduce pain. So they get an injury, we're trying to control their pain, control their inflammation to an extent, and make them feel better. Then we get into range of motion, strength, return to sport activities, and finally discharging them back to sport. But pain is the number 1 thing, and sometimes that phase lasts a lot longer than we might expect or we might want. And that's okay. Everyone heals a little differently. So what we're going to do, I want to know what your strategies are when you're dealing with someone with a high level of pain. I want to know if you've had any stories of patients that have an interesting opioid use story, and maybe you just write in the comments or shoot me a private message. Very interested in this topic. It's something that I think a lot of therapists might overlook, but pain is definitely real, and we serve a really good role in helping reduce that. We know that movement, not to belabor this, but movement helps your natural release of endorphins, which have their own pain relieving effect. So if we can get someone up moving and get their heart rate going a little bit, and as long as we're protecting their injury site, the appropriate stage of healing, if we can make them move, and that usually makes people feel better, regardless of pain medicine or whatever. So thank you guys for checking out. This is the first Nerd Out Wednesday, and the journal will be available. I'll write it in the comments section of this video. Again, it's an open access article, so you should be able to view this and dive a little deeper. So thank you guys so much. My name is Rishel Linville, sports physical therapist. This has become a part of the Become a Better Human project. And I appreciate you guys tuning in. Subscribe if you like these videos. Thanks.